afternoon. How's everybody doing? Good. Do I? Yeah, I guess I'll keep it up here. Okay. So anyway, welcome. My name is Laurel Sterling. I am a registered dietitian and wellness educator here, and this is Carol Blair, and she's also it's called a wellness educator as well as homeopath and certified nutritionist. That's what I was trying to remember. I was going to say something other. Anyway, so I see a lot of familiar faces. Thanks for coming here. How many of you are stressed? Anybody? Nobody? Anybody? Yeah, just a little. I'm surprised that this isn't more, well, you just got two hands up. You know, with all the people out there that have a lot of stress to deal with on a daily basis, and that's what we're going to talk a little bit about today. And we can keep this casual. You don't have to wait till the end for questions. You can ask us as we're going along, especially because we don't have a lot of people and we've got plenty of time for this. So, okay. So, I was reading something and they were talking about how 90% of doctor visits per year were stress-related. If you go backwards as far as looking at the cascade of what causes it, as I get to in some of the some slides, you'll see that the whole backlash of this is typically, you can backtrack it to stress. That people, I have a lot of people that are coming through, clients that say, yeah, all of a sudden I was getting this and I had this person pass away and this one and this one and this one, and just recently I had a woman that had close to 7 close deaths within 1 year that were close family members, including her husband. And she was having issues with sleeping, and I forget what else. I think it was mainly a sleeping issue, and some of her blood lab values were off. And so I had talked to Carol a little bit about her lab, and she said, oh boy, that's actually, the electrolytes are off, and that's typically looking at your adrenals. And so I said, oh yeah, as I was piecing it all together, that yes, it goes back to the adrenal glands, which we're going to be talking about. So, feeling the pressure, this is where it starts. Is pressure mounting? So, don't you want to live life to the fullest, feel good every day, wake up and be refreshed in the morning, feel like you've had a good night's sleep, have the energy to do the things that you want to all day long, living without pain? A lot of pain, you can backtrack it to the adrenals as well, aging gracefully and healthfully. We all would love that. So this is the stress cascade that I was talking about. So as I said, some people have this ability to just blast out to someone as far as when they're upset, and they'll just yell and let it out. I actually have a few family members that they just let it out and then they're absolutely fine. But then you're left with, oh my gosh, what's going on? Why is this happening? And so it's everybody's different in how they deal with stress. Me, I would hang on to it and brew and stew, and some other ones just let it out and it's gone. But if you internalize it, and it's internalized different in everybody. Headaches, backaches, stomach aches, anywhere in your body where you might start feeling irritable bowel, or you might start having some anxiety or sleep issues or whatnot. So basically this is how it starts. The hypothalamus in the brain signals the pituitary, which increases the production of this adrenocorticotropic hormone, which in short is called ACTH. That signals the adrenals, which are little tiny glands that sit on top of your kidneys. And they're working all day long with this feedback, biofeedback or positive, negative that's going on in the body, bringing hormones down, bringing hormones up, down, dealing with the hypothalamus and the thyroid and whatnot. And they produce over 28 different hormones. So we're talking about cortisol, your serotonin, happy hormones, your sex hormones, all sorts of hormones, melatonin, all through the day. They're being taxed. And so this ACTH signals the adrenals to release the stress hormone, cortisol and cortisone. What happens is with this is initially, and Carol's going to talk more about the stages of the stress, but initially, this goes back to the prehistoric times, as she's going to talk about, where as a bear or whatever starts coming to chase after you, and you need that adrenaline, you need the cortisol rush, you need the blood sugar to be increased, to release to the muscles to run away. that is a necessary thing. It's actually a pro-inflammatory state, which is good for a very, very short time. And then what's happened is you should be able to calm that down, and the hormones should calm down after that. But if not, other problems ensue. And there's actually I don't know if it's a book or a movie, but I've heard it referenced where it's called Why Zebras Don't Get Ulcers. Has anybody heard of that? Well, actually, what they do is they show a zebra being chased after by a lion, and the zebra gets away. And then they see the zebra in this whole minute to 2 minute shaking process where the body just convulses. And then after it's all done, it trots off and goes away, back to just resuming its normal day-to-day, trying to get food and whatnot. And so it's re-regulating, it's excreting and trying to re-regulate the blood sugar and everything else, the excess of hormones, and getting itself back into balance, and then going about its business, like someone who does their blasting. They can just let it go, and then they go onwards, because they've actually just let it go. But some of us manifest it inside. So this entire process, as I said, is pro-inflammatory, and it triggers the body to excrete amino acids, so you need higher amounts of protein this time, as well as minerals and electrolytes. And the body ends up becoming so deficient that it can't replete it fast enough. The stores get utilized, the body just ends up getting sapped, and that's in one of the phases, the last phase typically. So Carol's going to talk more about the phases.
So we have 3 phases, the alarm phase, the acute phase, and the chronic. So we'll address them individually. So during this alarm phase, that's when the body prepares for stress. That would be like Laurel said, you know, the typical bear in the woods kind of thing 100 years ago. But today, it's more like your computer crashed and you've got 6 weeks of work on it, and you've got 3 days to fix it again. And so for these few days, I mean, you are just, you know, ready to crawl up the walls. So your body is going into a hyperfunction state at that point, and we'll talk a little bit later about what to do at these various stages. So during the next stage, this is a resistance stage, so maybe there's some ongoing marital stress and accompanied by maybe some ongoing job stress. And so this is when the body starts to weaken because you're getting depleted, you're using up your reserves. The adrenals adapt by actually increasing in size. And so these little adrenals will start to increase in size, just like sometimes the thyroid will increase in size when it's not functioning properly. So then in the chronic exhaustion stage, when you reach this stage, this is called burnout, and this is when you feel overwhelmed by everything, and that's when you know you have reached a very critical stage. And if you don't do something about it, then you're going to be in serious trouble. You know, people think that doctors will sometimes say, well, you don't have anything wrong with your adrenals because they're testing for Addison's disease or Cushing's syndrome. But before you get to this level or this level, there's, you know, something in the middle where it started to go that way, and that's when you want to catch it before you get way over to Addison's disease or Cushing's syndrome. So we need the fundamentals. So we'll let Laurel talk about that.
Okay, so basically, fundamentals go across the board. I have what I usually call the core 4, which is a multivitamin, probiotic, calcium, magnesium, and D, and some essential fatty acid, which is a fish or flax or borage oil. But especially in these times, you really need to be focusing on that. And how many of us do that? How many of us let it go to the wayside when you're stressed? I've been there. Anybody? Anybody? Do you feel like that you're eating the best when you're stressed, or you're sleeping the best? Because then I found actually one time when I was, for whatever reason, I didn't sleep well. And so I got up in the morning and I found I was eating more carbohydrates. And then I started in the morning and the whole day just kept going that way. And then I felt more tired and more, it was just the lethargy kept going. And then I said, oh my gosh, what if my clients, I've had some that do this on months and years. I can't imagine sustaining myself that way. And I just have little glimpses of that. And I've gone through periods too. We all have stress. We all have issues, wherever it may be coming from. the thing is we need to be able to rewrite ourselves quicker than later and not let it lag, as Carol said, because once it does, you end up getting to the chronic fatigue, fibromyalgia stages. And I know there's times where I've just felt like I wanted to jump onto my skin because I was just so attached from all different sides. And I know when John Gray was here, he wrote that book. The older book was Men Are From Mars, Women Are From Venus. His newer one was Women on Fire, Men on Ice. So what he said in his book, and I remember some really significant takeaways, he said, well, women start out with a significantly less amount of ability hormone-wise to be able to adapt to stress than men. He said, and then on top of it, you have extra stressors. Now before we were in the hunter-gatherer, so women were around a lot of women. We were getting a lot of serotonin from talking and sharing and bonding and whatnot. And then now we're out in the workforce, so we're stressed about that. And then you come home, do you let down? No, now I got to cook dinner, and the kids are screaming, and I got to go right into this mode, so you don't have that letdown. And then if you don't have help from possibly your mate for helping with dinner or dishes or whatnot, then you spin even faster because you start picking up where everybody's faltering. And so that's women on fire. It just goes higher and higher and higher and higher. And I can't tell you how many women that I've had in particular that come in that I had one woman in particular that she was going to school and had family issues, had to move back with her son, and there were all these problems, and she said, I went to the doctor, they can't figure out what it is. Well, I just sat down and simply did a questionnaire and talked to her about her life and her history, and she said, oh my gosh, that fits me, and this is what I need to do. And so we were working on supplements and foods and lifestyle changes and all sorts of things, and it took a while, but she started slowly creeping back out of that because she was really at a point where her, I think it was 12-year-old son, was so concerned about her and how she was and her health that because she was having, I think, blackouts and all sorts of other issues, and then slowly she started coming out of it. Now, I don't have everybody that severe, but I have a lot of women that it's the nature of the beast. How many of you put yourself to the back and everybody else to the forward? Yeah, and then you come all of a sudden as you're maybe 30, 40, 50 years old and saying, oh my gosh, I just feel exhausted, and now you have chronic health issues creeping down because everybody else was put before you. And we need to learn to also put ourselves as a caretaker in front to be able to keep ourselves healthy so then we can take care of the masses, because if we don't take care of ourselves, we can't take care of others, basically.
Yes. One of the things I'd like to mention, you know how they say on the airplane to put your mask on before you help your children or the person next to you? It's the same thing. It's that same concept, because you can't help others if you can't help yourself first.
And I know that's kind of hard for us, especially as women, to think of that concept, because we naturally just put ourselves back. Everybody else has got to be taking care of the kids or this or that. But if we don't take that time, and we're going to talk about some ways of de-stressing, and I've gone through it myself. Last year, I actually had, from running, I overused a knee, and I was told by a PT, you can't run anymore. And so I said, what? That's a stress reliever for me. You can't take that away from me. And so I have yet to get myself back into a groove. I bought some not cross-country skis, the snowshoes, thinking this past winter, I thought, okay, great, I'm going to do that in place of it, and I'm going to get out there. Yeah, no snow, right? What a crazy thing. I thought, oh, for sure we're going to have tons of snow. And so then I have to get a bicycle, because then I got to start getting back into cycling. So I had something that was a stressor of a sideline from an injury. I've had people come in that were avid runners for years and years and years, came in because they had been seeing someone, a psychiatrist, psychologist, because that was their outlet, and it was taken away from them for some reason. And so they went into severe depression and anxiety because they didn't have it as an outlet. I mean, how many of you have been where you exercised and then you couldn't because of something, whatever it may be, and then you got back into it and you feel that euphoria again, you feel the stressors sort of melt away as you're getting back into the regime? You know, sometimes it doesn't feel good right away, but I know I've gone out of the house sometimes within 10 minutes, and all of a sudden I felt, oh yeah, it's all good. I'm running and everything's working itself out, and I come back and I've figured out whatever the issue is. So, basically, as I said, some of the supplements we're going to be talking about, you really need to focus, if you can only focus on a few, and I've been there again, where I've been sidelined before, so at least take your multivitamin, a B complex, and some magnesium, and we'll talk a little bit about why. Also, you need to know essential fatty acids, probiotics, vitamin D. We're going to talk a little more in depth on each of these in the next slides. So why do we need to supplement? Well, if you're looking at any of the latest studies and shows out there that they have on some of the Nightline shows where they talk about, organic strawberries, yeah, they're finding it has more of a nutritional value and benefits versus not. The soils out there, and I grew up on a farm, so I know, as far as about the depletions, what we used to do is rotate the crops. And they still do that, smaller farms, but the big farms out there in the West, they typically don't do that. They just overfarm, and then they replete it with nitrogen, phosphorus, potassium, and the SAD diet, which is the standard American diet, loaded with refined, processed, pesticide-laden foods. So when they looked at, I believe it was Tufts University, they did a comparison between organic vegetables and fruits versus non-organic, and they looked at the mineral content. It was incredible, the amount of differences that were in there. So, again, you're putting in, as Hippocrates said, let food be thy medicine and medicine be thy food. You should try to start from the food sources, but people think, I'm eating fruits and vegetables. Well, yes, but take it a step further. Try to decrease the burden on the body with less pesticides and add more minerals in there. Okay, so there are a lot of different vitamins and minerals, and I'm not going to get in depth about this. There are whole food ones. We have a lot of different lines out there, and any of us would be more than willing to talk to you about them. A lot of them, a lot of different variations between them. Some have different enzymes, some have probiotics, some are organic or partially organic, some are raw. It just depends on what you are specifically looking for. Typically, these are the ones that are easier to digest for someone who might have some sensitivities or digestive issues. Then there's the hybrid one, which has a combination of the lab-made vitamins and minerals as well as food-based, so it's together. And then there's the synthetic ones. And then within there's men, women, teens, one dailies, 50+ one day. There's all different variations. Again, I tell people, listen, what is going to work for you? If you are not going to take a 3 a day, let's work with a 1 a day then, and 1 a day for your appropriate age group. And let's be realistic, because not a lot of people, I have people that come and say, really, I don't want to take any pills. So then I look at liquids, or I look at a protein that has a lot of vitamins and minerals in that. As far as the essential fatty acids, these are essential for every single cell in the body, because all of your cells are made of lipoprotein, so it's a bilipid layer, so that's lipid is fat. So for the cells all to be able to take in the nutrients they need and excrete and talk to each other, communicate back and forth, they need these essential fatty acids. And they found, for instance, in women across the world, when they were breastfeeding, they were looking at the DHA levels in particular. The United States was severely low with what they had. So you start out with a low level, and then you breastfeed, and it gets even lower. And then there's this postpartum that's usually not connected in with that. But that is something that we need to do, is we need to give that to them, and not just them, but also the general public for a whole host of reasons. And so when they get depleted and they're breastfeeding, they get further, and it takes them about a year out to try to replete that back in. So, as I said, it's needed for lubricating joints, for hormonal imbalances, for the thyroid, for cholesterol, triglycerides, blood pressure, inflammation issues, your vision, learning. And there's all different types out there, and again, that would be something we would talk to you specifically about as far as what one to target for you. There are combination ones. There's one that I know Carol likes in particular, that's the Oil Smart. It's a fish flax borage combination. It has lipase, so it helps digest. There are enteric-coated ones. There are higher EPA, higher DHA. Some people like to just get it through the seeds. There's the chia seeds, the ground flax seeds that we have. There's hemp seeds, all sorts of options out there. Again, it depends on where you're looking for it, and that is something that the staff can help you with, or Carol and I can help you focus it better. Probiotics, that's the beneficial bacteria that we have in the gut. Now, stress actually does decrease the amount of flora in there, and probiotics, a lot of people just think that this is just for intestinal health, but this actually helps out with your immune system because 70 to 80% of your immune system is in your gut. It helps detoxify harmful estrogens, helps metabolize cholesterol, aids in the production of serotonin. Also helps, again, with the bowels, with diarrhea, constipation. So there are other things out there that can impede the probiotics, the normal flora that we have in ourselves, such as fluoridated, chlorinated water, pesticides, sugars, white flour. These all can set up imbalances. So you can get it from things like yogurt and kefir and sauerkraut and kombucha, but if you are taking something such as any kind of a antibiotic or steroid or whatnot, that's going to kill off a lot more and a lot faster. So you need to have something heavier duty to replete it back in, and then you can go on to foods like that or have them along with that. So again, there are a lot of different strains. Most people know of Lactobacillus acidophilus, but the L in front of any of the, when you're looking at the bottles, they have L period, and then it might be acidophilus or L period, longium, something like that. Those are all lactobacillus, and that's found in the upper intestines. And anything with a B in front of it, with a period B, bifidolactis or bifidoinfantum or bifidobreve, those are all in the colon. And anybody who is 50 and above, there was a study done in Japan that they found that when the natural aging process, the flora just started to naturally drop off, that when that dropped off, the putregenic bacteria that we normally get through foods and other exposures, the body just wants to keep itself in homeostasis balance, so it fills right in with something. Well, with that curve up, with that bacteria, the not beneficial bacteria, went colon cancer. So it's very important to get a combination of any of the Lactobacillus family, also with the bifido. Now there are other certain ones that are specific for C. diff, and if you have vaginal issues, there are ones that are found in those concentrate areas. Again, that's where, if it's more specific, we can talk to you about that on an individual basis. But in general, you want to have something of a combination, something at least over 1 billion. And know that once you initially take it, you may have a little bit of bloating, but that's good because you know that it's actually growing, and then over a week or so it will start to just regulate itself, and then hopefully keep everything regulated. There's shelf-stable, there's refrigerated, there's enteric-coated. That means you can take it any time of the day. Lots of choices. So Carol's going to get a little bit more into the supplements for dealing with stress.
Isn't she good? Okay, so we're going to talk about the supplements for stress specifically. Of course, always start with a high-quality multiple vitamin because you can't, when you're under stress, you probably can't get enough Bs just from a multi, but at the same time, everything else is balanced. And remember, the body has to work in harmony. So if you're taking calcium, for instance, you need to take magnesium to balance it out because you can't get calcium into the bones without magnesium and vitamin D and some other minerals. And you don't want to just keep taking one thing separately. If you took just, say, vitamin B2, you might get depleted of another B vitamin. So you have to balance everything out. But the B vitamins are crucial at this particular time. And one of the supplements I really like, Laura, could you show them the Be Healthy? That's one of the supplements I really like because it has extra pantothenic acid in it. And that pantothenic acid is B5. It's very, very important for the adrenals. Vitamin C is also important for the adrenals. And any buffered C that you like is fine, but make sure that it has bioflavonoids in it because the body can't accept just ascorbic acid. And one of my professors used to say, it's like trying to clap with one hand, you just can't do it. It just doesn't do any good. So you have to take the vitamin C with bioflavonoids. And magnesium. Magnesium is one of the most deficient minerals in our country. The two most deficient minerals in our country, in fact, are iodine and magnesium. And magnesium is responsible for, they used to say 300 enzymes, now they're saying 325. Probably by next year they'll say 350. I mean, it's just so important. Zinc and magnesium also, zinc is another one that's important for all the enzymatic reactions in the body. But magnesium is very calming. And when people can't sleep, I'll often have them take magnesium at night, or their calcium and magnesium at night, and it's really one of the best sleep aids in the store. You know, for most people, if you're just under a little bit of stress, the magnesium will make a big difference. Oh yes, and it helps to keep the adrenal hormones under control. Theanine, this is another great thing. In fact, I took some before I came in here because I don't do much public speaking, unlike Laurel, who does it all the time. So I took my theanine. But theanine is an amino acid that's found in green tea, and often if you can take it with green tea, it helps to get a synergistic effect. But theanine is great because it keeps you relaxed but alert. And it's really good for people with ADD or ADHD. It helps them concentrate better. But it also can help you sleep at night, too. But mostly in the evening, if you take it definitely with decaf green tea. Don't take it with regular green tea. But if you take that with a little bit of melatonin at night, usually that's a good sleep aid. And I think we have a supplement with those things in it, but I can't remember if we have it in here or not. Yeah, the Tranquil Sleep, I think. Doesn't that have melatonin in it? Yeah, that's a really good one, too. And phosphatidylserine is another important supplement, because it helps reduce those cortisol levels. Also, because it's a phospholipid, our cell membranes are made up of these lipids, and so this helps get it into the cell. And adaptogens. These are some of the most important herbs. I'm going to skip around a little bit because I'm going to start with my favorite one, which is rhodiola. I love rhodiola. Rhodiola I take when I first get up in the morning. It gives me some energy. Actually, Russian athletes have used rhodiola for a long time for endurance and stamina. So that just kind of gets me started for the day and helps with the energy and so on. So when people get up and have their caffeine in the morning, I get up and have my rhodiola. So I really like it, but it normalizes those cortisol levels, and it just has so many functions in the body. It just kind of helps reset the endocrine glands, and it even has some beneficial effects on the thyroid as well. And the other one that I'm going to talk about next is ashwagandha, because ashwagandha is a tonic herb. It's an Ayurvedic herb, and these tonics are good because as we get depleted, a tonic is something that nourishes again, and that's what ashwagandha does. So ashwagandha would be good to take in the evening. The real name for it is Withania somnifera, and somnifera means sleep. So that's, although it's a natural, kind of a natural sedative, it wouldn't put you to sleep necessarily like a drug would, but it does help relax you, and it just helps normalize all those stress levels. Holy basil, I think, is Laurel's favorite. She's a holy basil girl. And but again, that helps to regulate the blood sugar, and it helps to regulate the cortisol. So, you know, you can kind of find which ones work better for you as you experiment with them. Yes. Yes, absolutely. Yes, because the adrenals help balance out the cortisol levels, and the blood sugar plays a big role in all of that. So yes, it's very good for the adrenals. Whenever you can balance blood sugar, you're going to be very much better off. But there's a tea called Tulsi tea. That's really good. That's holy basil. Tulsi tea is actually holy basil. And I have one customer who says, I cannot get through the afternoon without my cup of holy basil tea. And sometimes she'll chill it, and sometimes in the winter she'll drink it warm. But she really likes that. Maca is another really nice herb, and you can even buy this in bulk, and you can put it in a smoothie. You almost have to put it in chocolate to really cover the taste. Don't try to put it in with your strawberry banana smoothie. It probably won't taste that good. But if you wanted to put it in like a chocolate smoothie, it works really well in that. And again, maca is good because it's full of minerals, and it has some B vitamins and enzymes and all that kind of thing. But again, it helps to reset those adrenal glands and that whole endocrine system. And I have had people take maca in just a couple of weeks, their hot flashes are gone. Maca works quite quickly. And it does come in capsule form. You don't have to eat it if you don't want to, but it is available in capsule form. Relora is a nice combination too, and we just actually came out with our own Relora under our store label, so I brought one in to show you. It's a combination of 2 herbs, and what they have found out is when they put these 2 herbs together, you get a very much of a synergistic effect, and it really helps people lose weight sometimes even because it reduces the cortisol levels, it decreases those cravings for sweets. And magnolia has a lot of properties for cancer patients. So often if I have stressed cancer patients, I'll suggest to them that they take Relora in the evening. And it does have some, the magnolia has some effects on particularly leukemia and lymphoma and some other kinds of cancer. But the combination is very good for relaxing. Passion flower is a very nice herb. A lot of times people will take GABA to calm them down. And passion flower has GABA-like effects, and so it's very calming and it's a good sedative, particularly to help people sleep at night. Licorice, very frankly, is not my favorite herb, but for some people it works really well. It does help to balance that cortisol in the body. For me, it's a little bit too stimulating, and you also have to be careful if you have high blood pressure. But a lot of people do really well with licorice. But if you have high blood pressure, you want to be very careful not to overdo licorice. Unless it's in the DGL form, like for ulcers, then that's another matter. And there's some great homeopathics. I live on Comforte. At night, when my mind is still racing from the day, I'll take a couple of Comforte under the tongue, and it just really helps me to help my mind relax and shut it down so that it's not quite so active. And then I can sleep. As long as I can help my mind relax, then I can sleep better. And the magnesium is the other thing that helps with that. So there are several cell salts that are helpful too. There's combinations, but one in particular called Caliphos. When I first came to Natur-Tyme 13 years ago, that was the cell salt I lived on. I took it daily, 2 or 3 times a day. But it's very good for relaxing. It doesn't work as well for me anymore. I think I used it up. But it was a very good combination for me then. We have another product now called 911 Burnout. It's the box, Laurel, that one? Yeah. This is really good for people who have been stressed out for a long period of time. Like I said, when you're just feeling overwhelmed with everything. This is a very nice product. It's put out by King Bio. And it's a combination of many homeopathics that just kind of, help people to relax and not be quite so stressed. And then, of course, we have the Rescue Remedy, which is the old standby that's been around forever. Rescue Remedy is great. I often put that in water when I'm getting ready to do public speaking and just drink it, slowly, or sip it for a couple of hours before I start. This is a nice friendly group, so actually this hasn't bothered me too much today. And of course, Laurel's here. She's so good, I know I can always turn it over to her. Do we have anything else there, Laurel? Oh, yes. Yeah, this adrenal health I want to talk about in particular because this was a product my naturopathic doctor recommended to me when I was really stressed out at one point in my life, and I was only sleeping like 3 or 4 hours a night. And even though I was still in that stressful situation, when I got on this, I started sleeping 5 or 6 hours a night, which was huge. When you're only sleeping 3 or 4 and you can add 2 or 3 more to it, it makes a really big difference, even if it isn't quite where you need to be. But this has the rhodiola, which, as I said, is one of my favorites. And it has holy basil, which is Laurel's favorite. And it has the ashwagandha, which is the tonic that I mentioned. This is called Adrenal Health. It's by Gaia Herbs. And their herbs are wonderful. They're organic, and, they just are a pristine company. And then also has Shasandra, which is good because it really helps the liver. And, sometimes the liver gets a big burden, and so that helps the liver in particular. And it seems like there's one other thing in here. Oh, yeah, the wild oats, which is a very calming kind of thing. These are a couple more formulas. This one is one that has mushrooms in it, one of the few formulas that we have that has mushroom in it. And this also has the ashwagandha, the holy basil, the rhodiola, and Shasandra. So that's a nice formula too. This one has cordyceps, which has been shown to also balance hormones. This one is adrenal essence. Yes, it is. And all the mushrooms are very immune modulating, and that's what I like about these formulas. Even if you had an autoimmune, you could take most of these formulas because they're not stimulating. There might be a couple you'd want to look at, but they're good to modulate the immune system, which is what we're looking for. This one is our Natur-Tyme brand. This is adrenal support. This one has Eleuthero in it, which is a little stimulating for me, but if someone needs energy and so on, this is a really nice formula. And this also has, I think, some rhodiola, some theanine, and ashwagandha. And then there's some licorice in here too, and a few other things. But that's a nice combo formula too. Now this one I wanted to mention to you. People who have a chronic fatigue often need adrenal cortex, but this is not for everyone. This can actually do you harm if you're taking it when you don't need it. So this is something you should consult on before you take it. This is very good when you say, I'll give you a perfect example. When I had hives because I had some dental work done and I reacted to something they gave me, and I got hives all over, my naturopathic doctor prescribed this at what she called the adrenal times, which would be 8, 12, 4, and 8. And so she said to take it, one every hour, and it really did. I saw a big difference when I took that. But when it calms down, then you have to stop taking it. It's not something you want to take forever. But people with chronic fatigue do well with this kind of thing. Did I go through everything? Okay. So what about the sleep? There's one more sleep formula, I think, the Tranquil Night. Oh, okay. All right. The cell salts, that was the bioplasma, which is a combination, or the Caliphos in particular. Caliphos, Kaliphos. Bioplasma. That's a combination of all the cell salts. And there's some others too, like Calcphos, Calchphos, helps sometimes with a wandering mind, so that can be a good one too. Yeah. So there's a whole study on the cell salts, and there are books on them if you really want to learn about them. They're really interesting and they're fun. What they've learned about the cell salts is that there are 12 of them, and they're actually minerals. They call them cell salts, but they're actually minerals that are in our body, and your body can't really function without them. And I had one lady, and I don't know if this is true or not, but she was diagnosed with cancer, an older lady, and it was early stage, and she just decided she wasn't going to do anything about it in terms of chemotherapy and so on, and she just kept taking different cell salts, and she said she's fine. So I don't know if that had anything to do with it or not, but she's fine now. So we're going to talk a little bit about different ways to cope, some things you can do. As we know, exercise is really, really important. And like Laurel likes to run, I like to walk. So, whatever's good for you is what you need to do. Listening to calm music, this rap music that these kids are listening to, it's no wonder they're so hyper. I mean, truly, some of that music they listen to, and it does make a difference. Right, yeah. Right, yeah. And meditation or prayer, is very important, just to, relax, let my mind relax, pray, whatever you want to do. And then the deep breathing. And I thought I might try a little deep breathing exercise right now, because a lot of people don't actually know how to deep breathe. So I thought we tried this. So everybody, because this is really, really important when you're stressed, and I have people who tell me this. So when you take your deep breath, do you want to do it? No. Okay. Oh, you want to do it? Okay. We'll all do it together. Okay. So you want to expand the diaphragm. So you take your deep breath, and you always breathe in through the nose, because those little hairs in your nose filter that stuff in the air. So take your deep breath and let your diaphragm expand. So you put your hand here above your tummy, and that should go out. So hand out to the count of 8. And then relax and through your mouth, breathe out. And then at that point, you're going toward your backbone. So your hand is going toward your backbone. Okay? Let's try it again. Okay, so you breathe in through your nose. And remember, that hand has to go out. Your diaphragm is expanding. And then let it out. Okay? Does everybody know how to do it? Yes, and most of us do the opposite. And as you breathe out, you can just feel sometimes your shoulders relaxing. I showed that exercise to my sister one time who was hyperventilating. I said, you need to breathe this way. She said, no, that's all wrong. You don't breathe that way. I said, I know you're not. That's why you're hyperventilating. This is the way you're supposed to breathe. So, yeah.
Like infants, they say that infants with their diaphragm, whereas I notice if I'm driving, I'm stressed, it's very shallow, the diaphragm doesn't move very much. That's why you're supposed to extend it out, and then...
Yes, you do. Yes, it will. Absolutely. Yes, good. And have you ever watched a dog when he lays down? That's exactly what he does. You know, they take that deep sigh and then they... Okay. We're going to run out of time because I think we only have 10 minutes left. So I'll let Laurel take over about the exercise again.
You know, I just wanted to make a comment about that. That is true, and actually the only way that I've ever been able to get rid of hiccups is I close my eyes and I take deep breaths, and when I feel like one's going to come on, I'm just holding my breath and I try to breathe through them, and that's the only way I've ever been able to get rid of hiccups. And it slows your heart. I picture my heart slowing down, and that's the only way I've ever been able to get rid of it. So the thing is, too, I'm not going to go through all these in depth because we know a lot about this last stuff. The most important was what Carol was talking about, that we're constantly, as a society, increasing or artificially boosting our adrenals with caffeine, sugar, nicotine, what else is there? There's drugs and all sorts of other things out there that we're constantly looking for the high to keep going. If in the morning someone's doing coffee and then they're having maybe a donut, and so it's just boosting. Well, the more that you do that, the more quicker you're going to burn out your own adrenals. So that's why we want to nourish them through the foods and through the supplements. Okay, so this is just about exercise. This is everyday things that we should be doing just to try to get in some extra. Then there's all the other things and the reasons why that we're supposed to be doing it. It helps with our organs, circulatory, lymph, muscles, you don't want to do overboard, because if you do too much exercise, then you're going to stress yourself in that aspect, and you don't want to do that. You don't want to injure yourself. Water, very important. Our body is made of 70% mineral water, so we want to make sure that we're getting, again, those minerals in, so you can get it in through the foods, the trace mineral drops. There's a greens drink that I like that has trace minerals in with it. There's a variety of different ways you can take with the supplements. You're going to get a lot through that as well. So it's very important to make sure that we get in good quality mineral water. Sleep, as we've been talking about, it can affect you in a major way. As I said, when I woke up that morning and said carbs, and that just set the day off, anybody can fall into that rut. You can feel crappy, and then it just keeps feeling that way throughout the day, and you want to stop that sooner than later. Sleep disorders have been linked to many chronic diseases like hypertension, heart disease, stroke, depression, diabetes, and there's many more. So it's and weight issues as well. So there's some natural sleep aids, and Carol's going to talk about some of those. She's touched upon some.
Yeah, we've talked about quite a few of these already. The magnesium, again, is a great sleep aid. Just magnesium or calcium magnesium before bed makes a big difference. GABA Calm is another one of these things that kind of calms your mind down, and we have a sublingual one that works really well. It's not a high-dose GABA, but you don't necessarily need a high-dose GABA just to fill those receptor sites and just let the mind calm. Sound Sleep is a nice formula. Again, it's from Gaia. I don't think I brought one in, but that's that combination of some of the things we talked about, except that this one has kava kava in it. So if you really have sleep issues, the kava kava is a really good thing to help you calm down. And valerian, of course, has been around forever as a sleep aid, and those are the two things I don't think we have really talked about. The Sleep Tonight is the combination of, these are some of the things that are particularly good for the adrenals, the ashwagandha, the theanine, the magnolia, the phosphatidylserine. That's a nice formula for, especially because ashwagandha is a tonic, so you're not just sedating yourself, you're actually helping your adrenals. And the Revitalizing Sleep formula was developed by Dr. Teitelbaum. He's the chronic fatigue guy, and he talks about, the fact that if you have chronic fatigue and you're not sleeping, then you're never going to get well, because it's when you sleep that you recover. So he developed this with some things, and then that one has wild lettuce in it, which some of the others don't have, and wild lettuce is another very good sedative. So you know, sometimes you just have to find the one that's right for you, and sometimes it just takes a little experimenting. Sometimes I find people will take one thing for a while and then it doesn't work, and some people need 2 or 3 things. They'll take this one tonight and this one tomorrow night, and that way the body doesn't get so addicted to one. Well, addicted isn't the right word, but it doesn't rely on that one. It just can do other things in the body. And then the tranquil sleep is another nice formula that I've had a lot of success with, because that one has 5-HTP in it, and it also has a little melatonin as well as that theanine that we've talked about. So that's been a really good formula, and that one's chewable, isn't it, Laurel? Yeah, that's chewable, and that's nice because it gets in quicker and works well that way. Do you have any questions on the sleep formulas?
You have to be careful with some meds, essentially.
Mm-hmm.
I had a girl in here today, she said that she was on some anxiety medication and said that she couldn't take melatonin with it, even though when I looked up the study, she said no theoretical interaction. But she said it actually had the opposite effect. She couldn't take it. She had a good result with melatonin before the medication. Once with it, then it tripped her into the other way. So.
And that's the same thing, especially with kava. Kava is another one you have to be really careful with medications. And any of these sleep aids or a lot of these anxiety things, you have to be careful when you're taking other anxiety prescriptions in particular or other sleep things in particular. So, yes. Mhm. Right. Yes. Yes, you probably would want to consult with Laurel or I on that so that we could help you to do that, and talk with your doctor, of course, about phasing down the drug. But, yes, so usually you want to do it slowly because your body's used to that. So we have a few books that we thought we'd mention to you here. Michael Murray has always been one of my gurus, and he writes great books. And he has one now on stress, anxiety, insomnia. And then, of course, the adrenal connection is really important, and James Wilson has written one on adrenal fatigue. He's also written a good book on the thyroid connection with the adrenals, I think, as I recall. And what's the other one you have? Oh, yeah, yeah, this one in the fibromyalgia chronic fatigue connection talks a lot about the adrenals, too. So those are just some interesting books that you might want to look at. And, of course, we have our lending library, too, that you can look into to find some things. These are some websites if you're looking to look up some information yourself and you'd like to be on the computer. These are some, the www.stress.org, the www help guide with mental stress, and then treating and beating, which is based on this book. So that you might get some information there. So we got some of this information from our talk from Beverly Gates and Michael Greer. We just want to give them credit. So just, you know, just live your life in a way that is going to benefit yourself. You just want to, you don't want to be stressed out all the time. It's really important to take care of yourself, so that you do sleep well at night, so you can help your family, so you can help others, but you do have to take care of yourself first. You can't just put everybody else first, as Laurel said, because you just get, after a while, you're going to be the one burned out, and then somebody's going to have to be taking care of you. So, you know. That's right. Mm-hmm.
Because again, when you look at his book, Treating and Beating, he says there's one of two types of personalities usually that come down with chronic fatigue and fibromyalgia. He said it's usually those that are caretakers and those that don't know how to say no, and they just put themselves out all the time. Mm-hmm. This is the Treating and Beating fibromyalgia and chronic fatigue. Yep.
Are there any other questions?